Hi, my name's Katie and I'm an occupational therapist. I work at Preston Hospital. I work on the major trauma ward. Previous to my role, there wasn't actually an occupational therapist based on the major trauma ward. So what used to happen is that mainly the physios would highlight the needs, and that tended to be really obvious occupational therapy needs, like needing a wheelchair or needing equipment for discharge. And then what they did to create the role was they put a secondment out initially, so that we could sort of trial having an occupational therapist based on that ward, because what they were finding was previously there'd be patients that weren't getting their needs met, that kind of needed to see an OT more often, and I was successful in that role. And then from that we did a big analysis of case needs. We did a few case studies, but also an analysis of unmet needs on the ward and what was now being met. Major trauma deals mostly with polytraumas, so that's people that have multiple kind of life-changing injuries, and there's a few different cases I could sort of focus on, but one that I'm going to sort of talk about is a traumatic amputation, who also had a brain injury. So he couldn't remember that he'd had the amputation because of his brain injury, because he was in post-traumatic amnesia at the time. So we worked a lot on kind of helping him kind of reorientate, bringing him out of that post-traumatic amnesia, but also helping him reorientate to the fact that he no longer had an arm, because it was his dominant arm that was amputated. So we did a lot on kind of working on using his other arm to engage in tasks, but also reorientating him to the fact that he didn't have that arm.